The cancer nightmare. Understanding the worst types. Cancer is a word that no one ever wants to hear, and for good reason. According to the Center for Disease Control, cancer is the second leading cause of death in the United States after heart disease. And while there are over 100 types of cancer, most cases are caused by around 15 types, including skin cancers, lung, breast, prostate, kidney, bladder, colon, and rectum. But when it comes to the worst types of cancer, two important factors come into play: the number of cases and the overall mortality rate. Unfortunately, some types of cancer can be incredibly difficult to beat, even with the best treatments available. These cancers can be challenging to treat and, unfortunately, often result in death. While any cancer diagnosis is scary, it's important to know about the worst types of cancers so you can take steps to reduce your risk. In this video, we'll take a closer look at some of the worst types of cancers and what you need to know about them. Pancreatic cancer. It's estimated that approximately 50,550 people will lose their lives to this aggressive cancer in 2023, according to the American Cancer Society. Pancreatic cancer can cause painful symptoms like stomach pain, blocked bile ducts, bleeding, and fluid buildup in your abdomen, ascites. It's tough, and unfortunately, there aren't any reliable screening options yet. But people with higher risk should have regular ultrasound and MRI/CT imaging tests to stay on top of things. Now, surgery and chemotherapy are often necessary when it comes to treatment. In some cases, radiation can also shrink tumors when they can't be removed, but not all doctors agree with this approach. Surgery to cure pancreatic cancer is only possible in 10% to 20% of cases. Brain cancer. In adults, brain tumors rarely start in the brain. They usually spread there from other cancers originating elsewhere in the body. That's why brain cancers caused by other cancers aren't included in brain cancer survival statistics. If a person dies of cancer that started in the lung and spread to the brain, that person's case will affect lung cancer survival statistics, not brain cancer survival stats. According to Cronin, cancers are categorized according to their site of origin. However, in children, most brain tumors begin in the brain. Family history and radiation exposure to the head are the only risk factors for brain tumors. Sadly, radiation exposure usually happens during treatment for some other cancer. But the good news is that treatment options for brain tumors are available. The type of treatment depends on the tumor type and how much the cancer has grown by the time it's diagnosed. Treatment might include surgery, radiation, chemotherapy, immunotherapies, or targeted therapies. Around 24,810 new brain and other nervous system cancer cases are estimated in 2023, with 18,990 people losing their lives. It's tough news, but remember, resources and support are available to help you or someone you know who might be dealing with brain tumors. Colorectal cancer. This type of cancer doesn't usually show symptoms at first, but don't worry. If caught early, it can be treated and has a great 5-year survival rate. That means around 90% of people with early-stage colorectal cancer are still alive 5 years after their diagnosis. Unfortunately, the American Cancer Society estimates there will be about 153,000 new cases of colorectal cancer in the U.S. in 2023, with 52,550 people losing their lives to the disease. But there is good news. A colonoscopy can detect and even treat colon cancer in its early stages. During a colonoscopy, a doctor uses a tiny camera on a thin, flexible tube to check for signs of cancer in your colon. If they find a small, early-stage cancer, they can even remove it during the procedure. However, large tumors usually require surgery and sometimes other treatments like chemotherapy, radiation, targeted therapy, or immunotherapy. These treatments can help shrink tumors and limit their spread. Acute myeloid leukemia. Leukemia is cancer in the bone marrow where blood cells are formed. Leukemia occurs when blood cell development stops and cells become cancerous. There are different types of leukemia, and one of them is called acute myeloid leukemia, or AML. This type of leukemia starts in the cells that have the potential to develop into red and white blood cells and platelets. However, instead of maturing into healthy cells, these cells get stuck in an immature stage and become blast cells. Having too many of these blast cells and not enough healthy blood cells can cause many symptoms, such as getting infections easily, bruising or bleeding easily, and feeling tired or weak. Unfortunately, AML is more common in adults than children, and doctors don't know exactly what causes it. However, some factors may increase the risk of getting AML, such as smoking, exposure to the chemical benzene, and previous chemotherapy or radiation treatments for other cancers. Regarding treatment, doctors may use chemotherapy, a stem cell transplant, or targeted therapies to treat AML. However, even with these treatments, it's estimated that about 11,310 people will lose their battle with acute myeloid leukemia in 2023. So it's essential to take care of ourselves, avoid smoking and exposure to harmful chemicals, and seek medical attention if we notice any unusual symptoms. Liver and intrahepatic bile duct cancer. Liver cancer is one of the most typical cancer kinds. Although it's not as common in the United States, the number of cases has increased in recent decades. In fact, liver cancer incidence in the U.S. has more than tripled since the 1980s. According to the American Cancer Society, there will be an estimated 41,210 new cases of liver cancer in 2023, with a staggering 29,380 deaths. So what are the main risk factors for liver cancer? The most significant risk factor is chronic hepatitis B or hepatitis C infections. Both of these infections are spread through bodily fluids like blood and semen. But don't worry, there's good news too. CDC recommends that all children get vaccinated with the hepatitis B virus. Unfortunately, there's no vaccine for hepatitis C yet. Another closely related cancer is intrahepatic bile duct cancer. This type of cancer occurs in the ducts that carry bile from the liver and gallbladder to the small intestine, where the bile helps digest fats from food. Watching for symptoms and getting regular checkups is essential if you're at risk for liver or intrahepatic bile duct cancer. Early detection can save lives. Ovarian cancer. According to the National Cancer Institute, this type of cancer is the fourth leading cause of cancer-related deaths in women. The good news is that if ovarian cancer is caught early, it's much easier to treat. The bad news is that it's much harder to detect in its early stages. Some early signs of ovarian cancer may include pelvic pain, the need to urinate frequently, and abdominal discomfort. Now, you may be wondering how common ovarian cancer is. According to the American Cancer Society, there will be around 19,710 new cases of ovarian cancer in 2023 in the United States alone, with about 13,270 of those cases resulting in death. It's important to note that there are different types of ovarian cancer, and the treatment options will depend on the type and stage. Some common treatments for ovarian cancer include surgery, chemotherapy, radiation therapy, targeted therapy, and hormone therapy. If you're experiencing any early signs of ovarian cancer, you must talk to your doctor immediately. Don't wait until it's too late. Esophageal cancer. The long, slender tube that delivers food from your throat to your stomach is the esophagus. It plays a crucial role in your digestive system. Unfortunately, esophageal cancer is a real problem, and it's more common in older men who smoke, drink alcohol, and have acid reflux. Acid reflux is when stomach acid enters the lower esophagus and can cause irritation over time. In fact, in 2023 alone, there will be over 21,000 new cases of esophageal cancer in the U.S. Unfortunately, over half of those people may not survive. If you're experiencing symptoms like difficulty swallowing, weight loss, or chest pain, it's important to talk to your doctor. Catching esophageal cancer early is crucial for successful treatment. The good news is that several treatments like surgery, chemotherapy, radiation, immunotherapy, and targeted medicines are accessible. The best treatment depends on how far cancer has progressed, so it's crucial to catch it early. Lung and bronchial cancer. Lung and bronchial cancer are the leading causes of cancer-related deaths worldwide and in the U.S. In fact, According to the American Cancer Society, there are estimated to be 238,340 new cases of lung and bronchial cancer in 2023. A staggering 127,070 people are expected to lose their lives to it. So what causes this deadly disease? Well, the most significant culprit is smoking and the use of tobacco products. Puffing away cigarettes and cigars can seriously increase your risk of developing lung cancer. But it's not just smokers who are at risk. Secondhand smoke can also cause lung cancer in non-smokers. The two main forms of lung cancer are small cell lung cancer, which is more aggressive, and non-small cell lung cancer, which is more common. There is hope if you or a loved one have been diagnosed with lung cancer. In the case of non-small cell lung cancer, treatment options include surgery, chemotherapy, radiation, immunotherapies, and targeted therapies. While cancer is a devastating disease, it's important to remember that there is hope. Medical technology and research advances have resulted in better treatments and higher survival rates for many types of cancer. Please know, you are not alone if you or a loved one has been diagnosed with cancer. Resources are available to help you through this challenging time, including support groups, counseling, and access to cutting-edge treatments. Let's continue to raise awareness about these deadly diseases and work towards finding a cure. Thank you for watching, and subscribe to our channel, and don't forget to like, share for more informative content.